My favorite thing about being a recreation therapist is that I get to work with patients authentically. I work in inpatient physical rehabilitation with older adults. We take a holistic approach when we work with patients, so we look at their mental and emotional functioning as well. Throughout the week, we have care conferences, and so that's a great time for me to meet with the rest of the allied health team, physiotherapy, occupational therapy, social work, rehab navigator, pharmacists, etc. And it's a great time for the whole team to talk about the patient, their progress, maybe their barriers to discharge, where they're at, and how we can support them in a collaborative approach. So I'm working with patients who have perhaps had a fall and they arrive to us post-fall for physical functioning. When we do those assessments, we determine their leisure interests and then we make a treatment plan with them, letting them know what we offer here at the Glenrose and then going from there. After the assessments, we plan for programming. So during the week, we have various group programs already in place, like art programs, yoga programs, social men's breakfast programs. So when I'm working with a patient, I'm setting up an activity to have the least amount of barriers possible for them. And then a patient is allowed probably to feel more comfortable to engage in that activity. Then the hope is that they engage in a state of flow. And when they're in that state of flow, the level of challenge is right where they need it to be. And I feel that that is a beautiful moment, and I get to experience that happiness that they're experiencing as well. The goal is always for a patient to return to community. When a patient is being referred community resources, that could look like city or town recreation centers, they're close aquatic centers. If it doesn't meet a patient's needs, then we'll look at private organizations as well. I like how recreation therapy is very creative, so we can source community resources and bring in people who have different specialties, like, for example, adaptive fishing. We're able to access the community to help a patient do what they want to do, and a patient isn't put in a box.